Okay, so we're talking about the wrist and hand this week. We're looking at carpal tunnel syndrome. So when you open the clinical pattern recognition orthopedic suite of apps, you'll see we are going to look at pain patterns. And you'll see this first pain pattern has a pain pattern of symptoms that fit within paresthesias in a median nerve distribution, right? So this is one of the inclusion criteria for many of the studies. When you click on that pain pattern, you'll see that one of the top hypotheses is carpal tunnel syndrome, and some of the other possible hypotheses is pronator teres syndrome and ruling out cervical radiculopathy. So let's just take a look at carpal tunnel syndrome here. When you look at the prevalence data, you can kind of see what kind of group tends to have this type of problem, and it's often people who use their hands a lot, okay? When you watch the clinical findings video, you'll be able to see someone complaining of symptoms. You can see she's using her hands a lot. Her hand is not in neutral. She has symptoms in her median nerve distribution, waking her up at night, and there's a positive flick maneuver. Okay, so this is common. When you look at the physical exam, you are looking for patient complaints that are characteristic of this problem, like development of clumsiness or weakness, pain at night during sleep, when with most other musculoskeletal conditions, people usually feel better at rest, and then work-related pain or paresthesias in the median nerve distribution, and them often trying to flick their hand, trying to get rid of the paresthesias. When you look at the risk factors, here are some things that you can potentially measure or observe. Then you will want to do a median nerve assessment and assess common nerve entrapment sites to nail the carpal tunnel, look for a positive Physio sign, and there are a number of other special tests that may be relevant depending on the patient's complaint and their work or function. When you go in to assess the entrapment site here, you can use the transverse spreading maneuver or the carpal tunnel spreading maneuver to assess the soft tissue and use this also as a treatment. So this is entrapment site assessment. When you look at the movement faults, oftentimes you're going to see overuse of the hand and poor postures. These are combined. Forceful gripping overuse tends to be a very common factor in these types of patients. It is relevant to look at grip strength testing, and then also relevant to look at upper quarter posture. In the associated impairments, certainly you may find a number of different impairments related to tightness of the upper trunk muscles, which might influence posture, spinal mobility, stiffness of the thoracic spine, weakness of the upper quarter. You can see there may be some dexterity loss that you can assess, and it's valuable also to assess whether there is loss of mobility at the wrist. And you can also use a figure of 8 measurement for swelling at the wrist and hand. When you look at the differential diagnosis, you should obviously clear out the cervical spine. You should potentially clear the upper quadrant, so you have some quick tests that you can do for the elbow, the shoulder, and then you really want to rule out thoracic outlet syndrome, which could also lead to paresthesias in the wrist and hand and into the arm. And then Allen's test can be used to assess for blood flow conditions that might be mimicking these symptoms or the cause of these symptoms. When you finally get to the interventions, you'll see that the guidelines talks about doing things to reduce entrapment. So there's entrapment reduction. You can see there's soft tissue assessments and treatments, soft tissue mobilization to the carpal tunnel, and potentially adding some median nerve sliders, some type of nerve mobility. And you can always do some associated impairment interventions to help improve the patient's posture. And when it comes to therapeutic exercises, you'll see that improving mobility at the carpal tunnel, allowing the patient to do that for themselves, using some median nerve mobilizations, and continuing to improve their thoracic mobility and their thoracic muscle length will help the patient to have a better base, a better posture in which to function. In terms of functional movement, it's wise to help patients find better postures that place the carpal tunnel in a more neutral position. All right, so don't forget, of course, that there's patient education and modalities. Ultrasound to the carpal tunnel, laser to the carpal tunnel, and neutral wrist splint is commonly used. And you really want to make sure the patient understands what's going on, how long it's going to take, what we're going to do in physical therapy, and how you can help yourself. You can also send them to the JOSPT patient perspective. You can click on that, and that should bring you to a patient perspective that the patient can read. And you can see that here. This is a new feature that we've added in an attempt to bring the highest level of patient education to the patient, and this is built into your PhysioU clinical pattern recognition ortho apps. All right, so that is carpal tunnel syndrome. That is PlayThatPattern, and hope you guys are having a great day and play in your apps to continue to develop your clinical reasoning.